Well, we're here at the International Plaza with Peel Public Health, and I just have to tell you, these folks are champions. They've been going around the clock, and I think the target is 7,000.
7,200.
Regional Chair Nando, thank you.
Thank you.
And where's Paul? Paul was here too.
Dr. Lowe.
And Dr. Lowe, and Mike Chin.
Hardest working MPP.
Hardest working MPP. Anyways, this is great, folks. The more people that can come out, the quicker we can open up. And we are going to open up very, very soon. And I have to say one thing about the summer camps. July 3rd is usually the time they open. They're opening up this year. Wow. Because of the great work that these people are doing. And they're doing a fantastic job. I'm fogging up a little bit, Jamie. I don't have the defog on this one.
That's all right. Yesterday we saw a huge demo at Queen's Park. The way up here I saw packed parks.
Yeah.
Just packed parks. What do you have to say to those people that are...
Well, you know something, I understand people want to get out and get fresh air, but when they demonstrate, it doesn't help. See, that's the difference. These people are getting vaccinated. They're working around the clock, the healthcare workers, and these people are demonstrating without masks. That just spreads COVID. Folks, the way we get through this, all those demonstrators come down here and get vaccinated, and we're going to open up very, very soon, extremely soon.
And all the parks are packed today.
Yeah, no, I understand. People want to get out and get fresh air, but through the protocols, the reason the numbers are coming down slowly, the ICUs are coming down slowly, because the vast majority of Ontarians are following the protocols.
And can we go to that first clip? How many people are going to get vaccinated here and how long?
I'll ask Dr. Lowe.
7,600.
Yeah. Dr. Lowe, 7,200.
Aiming for 7,500, and we've got almost 5,500 appointments booked, and we're booked solid through to the end of the event.
Fantastic, thank you.
But it needs to be said, we would not be able to do that without
hold on,
the work.
right over again.
Oh, sorry. It needs to be said on behalf of the Region of Peel, we couldn't have done it without Premier Ford. He's been a friend to the Region of Peel. He's been there for us. He's gotten us the extra. We wouldn't be here if he didn't get us these extra vaccines. So he's heard us. He's listened to us. Peel is closer. Doug, we moved $2 billion of products through here. We're a transportation corridor. We've got the airport. So without the Premier and all the extra vaccines that are coming, wouldn't have been possible. Victory will soon be ours because of the leadership of this Premier, and we're very grateful in the Region of Peel.
He's being modest. It's Nando and Deepak, Paul, Dr. Lowe. They're the ones that get the credit. But thank you, everyone.
You're welcome.
Thank you.
Thank you.
Appreciate it.
Thank you,
We have to get these built-in defoggers.
Yeah.
I know. Dr. Lowe, real quick.
Been in the same room.
Oh, very cool. Hi.
So how many people are going to go through here today?
So honestly, Paul Sharma is our clinical lead, and he can tell us.
Yeah,
Okay,
so
Paul, and your first name is? Paul.
Paul, last name Sharma, and so we're actually hoping, we had appointments for 7,600 people. We've had over 5,500 booked, and we're hoping more and more people come out to get vaccinated today.
And you're ready.
We are locked and loaded. We're ready to go.
Now, because you have a shortfall of about 2,300, does that mean you can walk up?
So the thing is, we're actually asking people to book appointments. We're not encouraging walk-ups, but if people do show up, we will not turn them away. But we are really encouraging people to book because we don't want to have lineups outside.
And your title, Paul?
I am I'm the mass vaccination program co-lead.
Fantastic.
Yeah.
Thank you. And Dr. Lowe?
Yes.
How does it look in Peel?
Honestly, we're seeing our third wave start to resolve. Cases are coming down. Our escape valve, which is the hospitals, that needs a little more time, more to stabilize. But I'm feeling that this is a bit of a turning point in our campaign. The air here is just one of ebullience and hope and optimism. And we're going to try to get to that 75% first dose coverage to change the tail of the tape. And I would echo what Chair Iannicca said. This is thanks to the provincial government's over-allocation to hotspots. Peel's been hard hit. We know that we've had a vulnerable population. We've been really grateful for the extra vaccine to be able to ramp up our vaccine offerings in Peel.
Great. And what does that mean if people are going out to the parks today? Like I can go to any park in Peel or Toronto or York and find it packed.
Well, I think the big thing is we know that people need the outdoors for their mental health and well-being. I've certainly made that comment as we went forward, and I think really as long as people are smart about it, making sure they're sticking with their own household, distancing, masking, avoiding close contact without any of those precautions, you can enjoy the outdoors safely. Please make sure you're not crowding or not going out if you're sick.
With this type of max vaccination, is Peel going to be opening soon?
I think with any opening, it will have to be gradual, but we certainly want to make sure we get to that first milestone of 75 first dose coverage, and then it's really important for people to remember, it's not one and done. We've got to push through to second doses, and then things will open more and more as our coverage grows more and more.